My name is Haley and I'll be going over the alerts, patient demographics, and the carry forward button. Alerts can be flagged for acknowledgement by having only a provider or all users acknowledge it. It will also force alerts to launch when the chart is opened. Important alerts can be listed in red bold font. The patient alert window now displays all existing alerts for the patient by hovering over the alerts button to view the list of existing alerts for the patient. Users can add alerts to a patient on the fly. These alerts are added one at a time and will not be available for other patients. You can include comments for each alert. PM alerts are now viewable in EHR. Medication alerts can now be added from the alerts template and viewed in the medication module. By hovering over the alerts button, you can now preview the alerts similar to the medications, allergies, and problems on the patient toolbar. In the medication module, you can see the alerts by hovering over the prescribing alerts button. To acknowledge an alert, select the one with the red flag and then select either acknowledge or acknowledge and close. To add a new alert, hit the Add Edit button and that will bring you to a new pop-up window, or you can highlight an old one and hit remove, or you can simply just close the module. To add a new alert, find the section you are looking for. You will have to scroll down to get to the next section. Select the one you want. Mark if it needs to be shown in red bold font. Mark if it needs to require an acknowledgement. Select if it's provider or all users, and then you can enter your comments. When you're done, hit save and close. The PM alerts are now viewable in EHR by clicking the PM tab next to the EHR tab in the alerts template. The patient demographics now have the height or the vital signs viewable by hovering over the weight. You now have a red ticker which shows you the number of allergies, problems, diagnoses, and medications, and those alerts will show up by hovering over the buttons. There's now a carry forward button which will carry forward your last visit. You will go to the navigation bar, look for last visit, and select it. Once you have the template open, make sure your specialty is there. Select which section you are looking for, whether it be the reason for visit, physical exam, assessment and plan, or the dictation. You will then select the encounter date by choosing the blue arrow and selecting your encounter. Once you have your date selected, you can highlight one HPI or multiples if you have them. You can copy all of them or just the highlighted ones. Once you select the ones you want, hit the copy forward button. They will then move to the current encounter section, and you can then copy a physical or your assessment or just use your HPI and hit close when you're done. Once you have completed this, you can refresh your screen by clicking F9 on your keyboard or closing the template and starting over. And once you're done, your HPI will now be there. You can then open it and make any changes necessary. Thank you.